And we now turn our focus to the Iran war. There was still hope for peace as delegations landed in Islamabad. But by morning, that hope completely faded. After 21 hours of intense talks, no agreement emerged. The negotiations have failed, leaving the world in a fragile limbo. The United States says Iran rejected its nuclear terms. Iran counters that the US delegation failed to build trust. Two sharply different narratives now shape the fallout. Interestingly, after Pakistan, Russia signals readiness to mediate both these countries, hinting at fresh diplomatic openings. Tensions are now rising around the Strait of Hormuz. Iran is claiming complete control of the waterway, while Trump has threatened a mine-clearing action. Let's take a look at some of the big statements by Trump after the Islamabad talks collapsed. All right, those statements from Donald Trump are now flashing on our screens, viewers. We're also now joined in by Dr. Cathy Lawi, CEO of Emotionate, an Israeli-based organization. Doctor, thank you very much for joining us here on NewsX.
Thank you for having me.
It's a pleasure to have you as well. Doctor, what do you make of the Islamabad talks? There are some reports that are also suggesting that the outcome of the talks that we saw was because Netanyahu might have called midway Donald Trump.
Look, I'm not an expert in politics, so this is not my field. I'm a trauma specialist, and I'm taking care of mental health in my country. What I can say about the geopolitical situation is that, you know, it's an ongoing process and it takes time. And what I hear is that around the world is that people are very quick to give their opinion and their expert advice. And whereas we don't necessarily really know and have all the elements to explain what's going on.
Right. Doctor, what do you make of the damage then that has been incurred through this war, not just in Israel or Iran, but the countries of the Gulf? There are also multiple reports coming in from Lebanon where we are hearing that any building where an Hezbollah is suspected to be is suddenly torched, blown to pieces, and the common man is suffering the most.
Yes. I think it's going to take a long time to recover from the level of mental health, from the damage which is created by war. And in a way, it's a characteristic of war. There is not much that, we can do about it except to really, slowly absorb the consequences of what happened and help the population. On the positive side, what I can say is that we have tools today to help people. We know how to help people self-regulate, and we know how to help people really also help the others in emotional first aid. So we have, at the same time as we have physical first aid, we know how to give emotional first aid. I think this is important. In our organization in Israel, we have this method available also in Arabic and in Persian and in Chinese and in Marathi, actually. And we're, welcome to translate our knowledge in other Indian languages. And I think whenever we talk about mental health, we have to look at what is possible and how to help people get better.
Right. Doctor, now, of course, people in Israel have also gone through continuous periods of stress. Some may also have reported symptoms of PTSD. What is it that you, through your organization and team, have been doing or plan on doing to provide aid to these people and to people in the neighboring countries, if at all?
Okay, so what we are doing is that we are providing, we have a protocol for first aid that we have developed in the last and worked with in the last 15 years in Israel, but also in Africa and in different European countries. And we are providing like a toolbox and knowledge to organizations. So we teach teachers for example, and counselors how to help the kids. We are teaching rehab personnel and emergency personnel the toolbox so that they will know how to help themselves and how to help others also in emergency. So our task is to get to a situation where we can have a maximum impact on the population. The numbers we have today are very alarming in terms of the number of people suffering from mental health symptoms. We're a very small country, as you know, compared to India, especially.
Yeah.
We are talking about 10 million people. We have 3 million people, at least 1/3 of the population, suffering from mental health symptoms, trauma, anxiety, and depression.
Okay.
And we are seeing those numbers increase, especially in our children and the teens, which is very worrying, of course.
Doctor, you've also spoken about how Israel still ranks relatively higher as far as global happiness reports go.
Yeah.
Why do you think that
Yeah.
resilience is there in the population of Israel?
Yes. Okay, so I think, we are quite a unique society in Israel because we have, on one hand, we're a very Western type society, but on the other hand, at the level of the sociology, the society, we are very family oriented, I think very much like in India. And there's a lot of support going at the level of the population, within families, within communities, helping each other, bringing food to the ones in need, helping those who are, whose husbands, for example, are in the army. And there's a lot of really resources which are connected to this capacity to help each other. The other thing is, which is very important, is that we have a sense of meaning. We feel that we are doing whatever we are doing when it comes to the war because of our survival. So there is a common destiny and a common meaning to what we are doing, which I think is very, very helpful. And I'm glad that you're allowing me to express this on the Indian News Network, because not too many people are speaking about that. So we are capable of holding the paradox of the difficulty and the solution at the same time. And that's a kind of a secret we would love to share with you, share with the world.
Well, yes, thank you very much then, Dr. Lawi, for joining us. And it's a pleasure to have you here on NewsX. And we now move ahead. We also cover some news from